already live video chat.
Hello.
Hi, how are you?
Hey, how are you doing?
I'm doing good.
Great.
Pretty good. Yeah. How are you doing?
I'm doing great. Excited to join.
Great. Great. So thank you for joining us tonight. And today, as you already know, we are going to talk about interesting topic called 19 vaccine rumors, fertility, and more.
Yeah.
So I'm gonna explain people who is watching us now. Nearly 70 of American adults have gotten vaccine against COVID-19, and that is a really high percentage of. But we are going to need everyone to get vaccinated if we are going to keep COVID-19 at bay and the winter. So there are a number of rumors going around about and why shouldn't get the COVID-19 vaccine. And I want to stress that used to word rumors because so many of them are demonstrable false statement with no evidence to support them.
Mhm.
So today we are going to have Olaninka Aquinola Harley and of Olay of Shorts. You can tell or explain us if I did it correct, your name?
I'm Oli. Oli, my
Oli, okay.
full name is Sauda.
So we are going to talk about some COVID-19 myths and the facts, especially around fertility. Oli is a physician assistant at Whitman-Walker Health, and she graduates from George Washington University in 2007 with a Master of Science of Physician Assistant Studies and Master in Public Health focused on community-oriented primary care. Welcome, Ali.
Thank you.
So, people who is watching us now, if you want to ask to the doctor any question, you can just put the question in the comment section, and we are going to answer the question made you have here in this live video. So, Oli, will introduce yourself, please.
Yeah, my name is Oli. I hope everyone can hear me okay. Um, I'm a physician assistant, not a doctor, so feel free to call me Oli the whole time.
Oli,
Um,
okay.
yeah. And I've been working at Whitman-Walker since 2018, but I was a student there many, many years ago, and I really love my job. Love working there, love the community we serve, and I'm happy to answer any questions about vaccines that I can answer. I've been vaccinating people full steam ahead in my practice, and I'm happy to answer any questions.
Great. So we are going to start with the question, Oli. And the first one, is, are you vaccinated against COVID-19? If you are vaccinated, how do you decide to take a shot?
Yeah, so I am vaccinated, double vaxxed, as they like to say. I got the Moderna vaccine and I got it on December 31st, just before the end of the new year. And I was very excited to get my vaccine because for the months prior to that, I had been doing a lot of COVID testing at Whitman-Walker. Y'all might remember that Whitman-Walker was closed for a lot of services, with the exception of COVID, when we were deep, deep into the winter side of the pandemic and into the fall of 2020. So I was swabbing a lot of noses, doing a lot of visits with people who were sick. And I was really concerned about coming home with that virus to my family. I have children, I have a partner. I was concerned for myself and I was concerned for them and anybody else I could potentially spread the illness to. So it was very important to me to get vaccinated as soon as I could. And I remember both days I was very emotional about getting vaccinated because I felt like finally I could protect myself and protect my loved ones and protect more of the community, because I'm big into public health. That's another one of my real passions when I'm working.
Thank you, Ali. So, thank you for your response. And the question number two I have for you is, if your clinical practices, what do you see people not getting vaccinated? What do you see as your role in getting them vaccinated?
Well, in my practice, I see my own patients that I see on a regular basis, and I see other people's patients as well. We all kind of share everyone's patients. I see them acutely and for follow-up visits. So it's pretty wide, the group of people I would see, and I see them for various reasons. But I always ask about people's COVID vaccination status, as well as other vaccines, because vaccines are life-saving tools that we have. In this pandemic, this vaccine is one of the tools we have, one of the most important tools we have to get back to our lives as we had them in the past prior to this pandemic. And I see all sorts of reasons why people don't want to get vaccinated. A lot of them you have to listen closely to. And so I start off by asking people when and if they got vaccinated. And if they haven't, then the real work begins with talking about the reasons why they haven't gotten vaccinated. And they're varied. But a great deal of them really focus on fear of the unknown, because a lot of people, I think, are very concerned that this vaccine is new and it happened too fast, or they just want to wait and see. But I counter that fear with listening and telling people that they have reason to have concern. It's not, people are not just making things up, but there's a lot of misinformation out there. And I deal in facts. I don't deal in misinformation. So I talk to people about the fact that less than 1% of people who have been vaccinated get COVID now or end up in the hospital. That 99.3% of people who are dying from COVID are currently unvaccinated. There's a variant out there. I'm sure everyone has heard about it. It's called the Delta variant. It's surging through the community. It's 60% of all known infections right now. So although we think that COVID may be coming to a close, it's on the rise again. And one of the things that you can do, one of the most important things that you can do for yourself and for your loved ones is to get vaccinated. And so we talk. I just listen to why people are concerned. And sometimes when giving them information like that factoid about people getting sicker and dying if they're not vaccinated, people start to understand that a lot of this misinformation is from people who are seeking a platform. Like anything on social media or on the internet, a lot of people have gotten popular from spreading misinformation. And I don't deal in misinformation. I only deal in facts. And I'm happy to share those facts in a visit or with anybody at any time while I'm in front of them.
Great. Thank you again. And we are going to go with the next question. So I have been reading some rumors that COVID-19 affects fertility. Is that true?
So I will say categorically is not true. And I am basing this on the things I've read and the science I know. I'm one of the providers at the clinic that sees a lot of female-bodied people for female health. I do pap smears, I place IUDs. I see a lot of women of childbearing age who are interested in preserving their fertility or optimizing their fertility. And there is just no physiologic way for COVID vaccines to get in the way of fertility. There's just no logic. There's no pathological way those things can cross. There's been a lot of misinformation, particularly from one German doctor who's been spreading a lot of misinformation about COVID vaccinations and fertility, none of which is possible. There's some talk about COVID vaccines altering the DNA, also not possible, not possible at all. So some of this information, again, is to control folks, to give people or to take people's agency away. If you're interested in helping people with fertility, everyone knows who deals with gynecological health or women's bodies health, that the best way to prepare your body for a baby is to take care of yourself and to supplement your diet with folate and to get vaccinated, because in pregnancy, you lose capacity of your lungs. And if you get pregnant while you have COVID or have had COVID, that puts you at risk for respiratory concerns. Pregnancy in and of itself is a hard burden on the lungs. There's a lot of oxygen that has to happen to the baby. So if you are avoiding COVID or trying to avoid COVID, the number one thing you can, trying to avoid risk for your fertility, the number one thing you can do really is to take care of yourself. And that starts with getting a vaccine.
Okay. And also, I have read about that everyone who is pregnant and breastfeeding should take a doctor before getting a vaccine.
Mm-hmm.
Is that true too?
So I think with pregnancy, the CDC has recommended you speak with your doctor, but has recommended pregnant women and those who are breastfeeding get vaccinated because, again, if you get sick, you put your body and the bodies of the baby at risk. In fact, antibodies are known to spread from mother to child. So one of the safer things that you can do is get vaccinated. There's a registry on the CDC website called VSafe, and we've been monitoring hundreds of thousands of pregnant women who have not had any complications from getting vaccinated. In addition, in the trials for the vaccine, many women got pregnant on accident. So there's absolutely no risk with fertility if that is happening during the vaccine trials. Again, this is information that is preliminary, but it is factual. And in fact, one of the safer things that you can do for yourself, your baby, your own health is get vaccinated.
Thank you again. Thank you for again to the people who is watching us. Please, if someone has any question, please leave the comment in the comment section, and Oli is going to help us to answer those questions you have. So also, I have here some rumors that COVID-19 vaccine change your DNA. Is that true?
Yeah, no, that's not true. I think it's a misunderstanding of mRNA vaccines. It's like, again, it's just not physiologically possible for it to change your DNA. The mRNA vaccines go in with a code, they teach your cells something, and then that's it. Once the spike protein is created from that mRNA vaccine, or even the adenovirus vaccines like Johnson & Johnson or AstraZeneca, which is not approved in the United States, then that code dies away and your cells know what to do. So there is no change to your DNA. There's no physical way that that could happen. That has not happened with any prior vaccine, and is certainly not happening with the COVID vaccine.
Thank you, Ali, again. Again, to the people who is watching us, today we are talking about COVID-19 vaccine rumors and rumor fertility and more. So if someone has any question to Oli, please let us know here in the comment section, and Oli is going to help to answer the question maybe you have. Saludo corazón, Gretel, Catalina. So now, with so many rumors, that how can people figure out what's true and what is not true?
So that's a really good question. But if you're in my office and you're here to see me for healthcare, you know that I would never intentionally steer you wrong or give you misinformation.
Exactly.
I don't promote things that I haven't read about and don't find factual. So just like you trust the doctors and the PAs and nurse practitioners and the nurses and all the providers at Whitman-Walker with your general health, please trust us with COVID. We've been researching and studying and following the science. We believe in the science, and we're here for you. We talk about what's real and what's not. We're here to debunk anything, or even just to hear you out and give you some more information so you can make your own mind up. Y'all are smart participants. You know.
Oli, are you there?